So you've had one or more pregnancies, or maybe you gained and lost a lot of weight, and you need both breast and abdomen surgery. Often called a mommy makeover, but sometimes done in men as well. This is a procedure that can make a dramatic difference in how you look and how you feel about yourself. Let's take a look at how it works. So either you've had a pregnancy or more, or you've gained and lost a lot of weight, and your breasts and your belly have paid the price. Your contour isn't what you hope it would be, and there's extra skin and possibly extra tissue inside as well. This can be fixed in a combination breast and abdomen procedure. In women, it's sometimes called the mommy makeover, but it's done in both men and women that have combination problems with breasts and abdomen. With the abdomen, usually there are loose muscles. The muscles in the middle of the belly are called the rectus muscles. And when you're thin and young, they touch each other in the middle. Weight gain or pregnancy pushes out the belly, the muscles spread out to the side, and this is called diastasis recti, which really means just a separating of the rectus muscles. When somebody has this problem, you could do all the sit-ups in the world, and you're never going to get that six-pack because the muscles are pushing in on the sides, and the middle is popping out. And so one of the goals of doing an abdominoplasty or tummy tuck, which is part of this procedure in most cases, is to bring those muscles back to the middle. The other goal is to get rid of the extra skin and fat. The skin and fat can be on the front, on the sides, or all the way around. Each case is different. How do we do that? Well, in this procedure, the first thing we do is we draw a circle around the belly button and we leave the belly button where it is. We don't make a new belly button. We just circle around it so that we can lift the skin and fat all over the abdomen and leave the belly button in place. Then we draw a line above the pubic area from hip to hip. And that incision goes down to the muscle and we lift up all the skin and fat up to the breastbone just below the breasts. Now we have to take a look at how low we can make the incision. And I very frequently hear patients say, well, I want to wear this bikini and that bikini, and can you put the scar down here? It doesn't work that way. There are people that will tell their patients, bring in a bikini and show me where you want the scar. I love to tell my patients, well, maybe their nose is growing just a little bit when they explain it that way, because it doesn't work that way. So what you do is you make the incision initially a little too high. You raise the flap and you pull that top flap down until you see it turn white. Now, in most cases, and if you're lucky, it's still turning white when you get that flap all the way down to the pubic area, and then you remove the extra skin that you left at the bottom because you know you're going to have no trouble closing it. But really, how low you're getting this flap is dependent upon the blood supply and how far you can pull it down and still have nice pink skin. So again, in most people, that lower incision is down by the pubic area. Now, once you've done that, you've pulled the top skin over the top of the belly button, and there's no belly button. But we're going to come back and get that later. So now we know where the flap is going to be in terms of the upper and lower incision. So we lift up that skin and fat again and liposuction the sides with laser liposuction in almost every case to bring the sides in to match. Now we're looking at these muscles that are spread apart, that diastasis recti we talked about, that happen from the weight gain pushing the muscles outward or the pregnancy pushing the muscles outward. And what we do is we sew those muscles together with stitches that kind of resemble shoelaces. And so now your rectus muscles are back together in the middle where they belong. You can make a six-pack. You've got this nice, tight, small belly, and your waist came in too because we pulled the muscles inward, and when we do that, the waist gets narrower. Once we've done that, you're a smaller person. You didn't need nearly as much skin as you had before. We're easily able to pull down that upper flap and close it, but we covered over that belly button that we left initially. Because remember in the beginning, we cut a line around it and left it in there. So we tack down the upper flap to where it's going to go. We feel inside, we say, oh, there's the belly button. We make a hole, and out comes your original same belly button. At the end of the procedure, you've got a line across the bottom and a circle around your belly button. And those are the lines that are going to remain forever, hopefully as little tiny fine white lines. And we'll talk about scar treatment and how to make that better in another video. But that's the tummy tuck part of the mommy makeover. We've lifted the skin and fat. We've thrown the extra skin and fat in the garbage. We've liposuctioned the sides with laser liposuction in almost every case to bring the sides in to match. Then we've narrowed the waist by tightening the muscles, and we pull down that upper flap, and you've got a nice, tight, flat abdomen with a narrow waistline. You're set up to be able to get that six-pack later because the muscles are in the right place. So now that we see how the tummy tuck part works, let's take a look at the breasts. With a combination breast and tummy procedure, the breast can come in several different shapes. In some people, because of the weight fluctuation, there's a lot of extra skin, but an involution or loss of the tissue inside. In those people, the extra hangy skin needs to be removed and the shape restored. That's just a breast lift. In other people, there may be so much loss of breast tissue that a lift would leave very small breasts that are not very shapely. In those people, one could consider adding breast implants. The lift and the breast implants, or sometimes the implants alone, would solve the problem. Then there are people who get large and stay large. Sometimes hormonal stimulation of the breast tissue results in a permanent increase in breast tissue, and people find they have overly large breasts later. In those cases, one would consider a reduction. Breast reduction along with tummy tuck is a very common combination. What about just laser liposuction for a mommy makeover? It's certainly possible that in some people there's a small amount of extra skin, and the tightening that you see with laser liposuction would be adequate. But that's unusual. In most cases, significant weight fluctuation results in extra skin, and the extra skin is permanent. If you look at people that are overweight, they don't have thin skin that's stretched out. When you put skin under tension, your body actually grows new skin. And so after the weight loss, that new skin remains, and there's no exercise that's going to tighten it. And so in most cases, both with the breasts and the belly, you need to address the extra skin, and that requires either a tummy tuck or a breast lift, or both together. So this is a procedure that can be done in one sitting. The breasts and belly are usually done together. When you do this, it takes 1.5 hours to 2 hours to do the tummy, 1 hour to 2 hours to do the breasts, and most people are home a few hours after the surgery. Yes, some people stay overnight, but that's their choice because they want extra care. I use a very long-acting local anesthetic to block all of the areas that are going to be operated on before I start. And so the amount of anesthesia necessary is greatly reduced because you're not feeling anything during the surgery. The area is already numb. You wake up and you're still numb for 14 hours, so you feel next to nothing. You start your pain medicine in the recovery room. You take it every 3 hours by the clock for about 5 days in decreasing doses. And most people have little to no pain because it's managed properly. You're up and walking about that day a little bent over, but we're not doing housework or we're not doing chores or lifting heavy things or twisting and straining. We're staying home and watching TV and making your own lunch, yes, but not doing a bunch of housework and things like that for the first 2 weeks. After that, you're out and about to most activities, but I don't want people back to the gym and working out for 4 to 6 weeks, depending upon the person. You see the vast majority of results immediately. Your breasts look great. Your belly looks half the size. But after any surgery, there's swelling. And so the last 10 to 15% of the result is going to be masked by that swelling. So while you look better immediately, over the next 6 months, you're going to continue to look even better. For further in-depth explanation, see my YouTube channel, my website at drstudin.com, that's drstudin.com, and follow me here. I'm Dr. Joel Studin.